Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine in Pennsylvania for our members and their patients. Thanks for tuning in.
Hello, and welcome to the latest episode of the POMA Does podcast series, sponsored by the Pennsylvania Osteopathic Medical Association. I'm Dr. Pamela Goldman. I'm a board-certified internist, and I'm joined today by Dr. Angela Rattini, Dr. Samantha D'Souza, and Dr. Sean Duffy, and we are going to talk a little bit about research today. So I'm a board-certified internal medicine physician. Prior to going to medical school, I had worked for a pharmaceutical and had done toxicology research. After medical school and after residency training, I also had done some clinical trial work with publications, peer-reviewed journals, as well as a book chapter completed as well. So I'm going to talk a little bit through our discussion today, a little bit about what it looks like to be a practicing physician doing research. We also are joined by Dr. Angela Rattini. Why don't you go ahead and do an introduction and a little bit about what you might talk about today.
Hi, my name is Angela Rattini. I'm a board-certified family physician who has added certification in geriatrics. And I'm the Associate Program Director for the Lower Bucks Hospital Family Medicine Program. I'm also chairing the Committee on Scholarly Activity. I've been in practice for many years now, and I've been part of the residency training program here at Lower Bucks since its inception, and was also a clinical trainer prior to that at the Delaware Valley Medical Center many years ago. So that's pretty much what I do. I can turn it over to Samantha.
Thank you, Dr. Rattini. Hi, my name is Dr. Samantha D'Souza. I'm family medicine PGY3 at Lower Bucks Hospital. My current role is also heading the scholarly committee, just, getting everybody involved from a resident standpoint and creating awareness about research and kind of developing more of a thirst for it. I guess that's what my specific role is. When I was in undergrad, I did some research with the Carl Wiseman Science Initiative in teaching and implementing chemistry modules. Currently, I am heading the scholarly committee chair, trying to not only transition our current program from AOA to ACGME, specifically in the scholarly department. But yeah, and I thank you so much, Dr. Goldman, for inviting me for this podcast, and over to Dr. Duffy.
Great, thanks, Sam. My name is Dr. Sean Duffy. I'm a family medicine physician. I've recently finished up residency, and I'm here to bring a little bit of perspective on how to take your research and either use that to empower you, potentially you as a physician, either in training during your residency program, and also bringing research out into the community to help for the betterment of our community at large.
Excellent. Well, we're so glad to have all of you here today to kind of talk about the different aspects of research. I don't know about you, but when I hear the word research, I think people in safety goggles, white coats, at a chemistry bench with lots of beakers, with smoking things and whatnot. And while that is research, primary research, physician research looks a little different. And each of us has had experience doing research as physicians that doesn't necessarily look like bench chemistry or animal models or cellular models as well. So we just wanted to bring a different perspective of that. I had the opportunity as a physician when I finished my residency to work for a research institute, the Lankenau Institute for Medical Research. And we actually were one of the main sites for the novel anticoagulant studies that had come out now over a decade ago. How exciting it was to be a part of phase 2 and phase 3 trials, and then extended trials for the landmark study on Pradaxa, and dabigatran, and just how that has opened the whole world of novel anticoagulants and alternatives to Coumadin. So lots of opportunities there. I happen to have worked as a hospitalist, working 7 on, 7 off. And on my off week was when I had the opportunity to go ahead and do some of this work with pharma drug development. Really exciting, meeting amazing people and learning in the whole process. There's also a concept as a practicing physician, and we'll talk about other ways that practicing docs can also participate in research. But there's also translational research, which is defined by Merriam-Webster as medical research that is concerned with facilitating the practical application of scientific discoveries to the development and implementation of new ways to prevent, diagnose, and treat disease. It's really taking a small sample size and really taking a look at how we can impact patients today, based on information that we have on a small scale. So research can be very expensive. It could be multi-millions of dollars, but it can also really be at the bedside or in the exam room. So I just want to encourage you with all of that. Other kinds of experiences, and oftentimes the first experience with research that many physicians have is when they're in residency. Maybe when they're a medical student, but more so residency and definitely fellowship. Some of the main kinds of research being done with residents is quality improvement projects and scholarly activity. And so Dr. D'Souza and Dr. Duffy will talk a little bit about those. Dr. Rattini, since we're kind of starting to talk a little bit about what does research look like? How do you get started? How are we defining it as a physician community? Would you mind sharing just a little bit about your experience with the ACGME, with graduate education, research, and whatnot?
Well, transitioning to the ACGME program has really expanded what we're doing as far as research and quality improvement. And they have specific guidelines for these things and is quite extensive and gives the residents quite an opportunity to do many different items. When it comes to scholarly activity, the ACGME actually has it set up as two separate items, but they can commingle. The first is quality improvement, or QI, and the other one is an actual scholarly activity, which can be strict research with human subjects, which would require an institutional review board or IRB review of the program, down to case studies, or even being a member of a professional committee, such as Pennsylvania Osteopathic Medical Association. But they do list quite a few items that you can do for scholarly activity, which would include things like grand rounds, posters, podium presentations, grant leaderships, non-peer reviewed print or electronic submissions, journal reviewers. So there's quite a bit you can do. The nice thing about all these programs is it's not the onus of one resident to do this. You can work in groups with this. For the QI project, they do recommend having 4 or 5 residents work together on a project. The purpose of the quality improvement projects is to actually improve something in the hospital for direct patient care, or for the community as well, as an outreach to improve the health of the community. So 4 or 5 residents can work on that. A few residents can work directly on research projects. However, each resident must be a first author on their particular facet of that research. So you all can't have the exact same poster, so to speak. But there are quite a few different opportunities. So it's not an onerous project. And I was going to have Dr. D'Souza talk a little bit more about how the program is set up through Lower Bucks, and so that it's done over your 3-year residency program.
Thank you so much, Dr. Rattini. Hi, everyone. So as I previously stated, I am part of Lower Bucks Hospital's Scholarly Committee chair from the residents' point of view. One of our goals and initiatives this year has been to include PGY 1, 2, and 3 representation within the committee. The goal mainly is to get everyone on board and educated and give them time to, check in with their peers even, and then drive the sort of research and quality improvement projects that they want to do. They could also do case studies, case reports, submissions, poster presentation, webinars, retrospective kind of studies, but looking at data that has already been collected, things like that. So that's kind of the paradigm shift that we've had a little bit recently in the past couple of years. So last year we had our very first, and I say last year in quotations because I was PGY2. So technically Research Day, May of 2022 was our first research day. So that was our pioneering effort to get everybody to create either their podium presentation or poster presentation option and present their kind of research to their peers, that the faculty, the staff, anybody that was interested to come to research day. So that was quite the initiative in getting everybody on board. And so we have family medicine residents, internal medicine residents, podiatry residents as well. And each of our activities, whether scholarly activity versus quality improvement, have a faculty attached to them. So that way we get the faculty involved in it in the research and gain their interests. So yeah, so that's a little bit of our sort of structure. We have like a flow sheet that has like people's names from PGY1 to create an idea, PGY2, collect your data, PGY3, analyze your data and present it. So I guess that's my simplified version of it.
But it makes it easy, right? Breaking down, that larger project idea and how do you really get started? And I think, doing that step by step and having that hand holding and making it very clear, delineated timeframes for when things can happen. I think that that's really empowering. For sure.
Yeah, absolutely. It definitely demystifies what research is.
Excellent.
It's really important to take the strategies that you all learned in medical school. Like we were always told the pancake metaphor, it's better to eat your 3 pancakes a day instead of putting off Monday's pancakes for Tuesday. Because if you do that the whole week, you're going to be eating 15 pancakes by Friday. And it's not going to work out for you, right?
Absolutely. Absolutely. And having a formal way to do it. Dr. Rotini was showing us the spreadsheet for each of the residents and, keeping track of that, not only because it's a graduation requirement from your residency, but also because it really truly does keep people on pace to where they need to be to complete whatever project they've started. So Dr. Duffy, would you mind just sharing a little bit about what project you had done and recently completed for your community-based research?
Sure. So what I chose to do was to try to take what we learn as a discipline, as physicians, as the medical community, and try to bring that to the community at large and see what sort of impact with that information. So I took the opportunity during COVID. I worked with the Warminster Township Free Library with their children's librarian, and we tried to put together an educational series of videos that could replace some of the in-person programming that was lost, as well as educate some of the younger demographic about some important health issues at an educational level that would be appropriate for them. So we took common health literacy topics like hand washing, heart health, sunscreen, and we put together an educational activities that involved a story time that the kids could, watch as part of a companion video, along with a Q&A discussion with me about the topic and go over some of the salient points that we were going to go over, and then as well as go into our hands-on experiment portion that involved a take-home kit that the parents could work with their children while they watched the video and put together the experiment that we were also doing on the video and work with us together and see what were we trying to demonstrate, whether it was hand washing and trying to show proper technique versus improper technique and the implication of doing it, better versus worse. If it was sunscreen health using UV beads and putting different levels of SPF sunscreen on them and then putting them out in the sun and try to see which beads, changed color the quickest versus which ones changed color the slowest, and to compare that as an analogy for what is happening with your skin when you get a suntan and potentially a sunburn to try to illustrate the concept. Same thing with the heart health one, where we're making a model almost like MacGyver, where you're taking a mason jar and a rubber balloon and some straws, some water and food coloring, and you can actually make a pumpable heart. And that if you put your hand on the little balloon diaphragm that you made, it would actually squirt the liquid out, as though your heart. And then what would happen if a big bad plaque got in there because you weren't eating healthy or exercising like you should, and try to make that information real for them in a way that was accessible, even with the restrictions that we had with curtailing in-person programming during the pandemic.
So not only it's reproducible, what
Right.
you're providing is a community-based, it's for a general audience. That's really powerful research. And Dr. D'Souza, you had also done some quality improvement type projects in addition to helping with the residency research day?
Yes. So one of the quality improvement projects with my senior who's graduated, Dr. Ruggie, she and I realized that our current community health center that is at Lower Bucks Hospital, the EMR EMR system that we use was a little bit dated. So what used to happen was some of the labs that were drawn, we either wouldn't get it electronically transmitted to the EMR, or which led to patients not being made aware on time of their results. And most of the times what happened was patients were like, well, I didn't hear from the doctor, so I must be fine. And that wasn't necessarily always the case. So we wanted to implement a system with our staff without trying to, pile on a lot of work on them, in order to kind of do some checks and balances to make sure that the lab turnover rate was appropriate. If there was any missing labs, how would we capture it in the system? And just overall basically gets given to the physician to review and then call the patients back. In doing some of these strategies, so what we did, say a patient came in, we had like posters everywhere, like, hey, you can sign up for this EMR login patient portal, and that would allow you to see all your labs as well as communicate with the physicians. So that cut down a lot of the calls, like, hey, did my lab come back? What happened? That helped the staff, for example. Another way was to also have the staff go back by the end of the week or even by the end of the month, however it was flexible to the staff, and reconcile some of the labs. So if there was anything that was sent out within the past 30 days that wasn't reflected back, they were able to either pull it out through external sources like LabCorp or Quest if it did not electronically get transmitted back. Again, what that allowed was like, hey, we're making sure that all the labs that were sent out, at least on a weekly to a monthly basis, gets reconciled so that it's in front of the provider and they see, yep, this patient needs a callback. Yet, no, this patient does not require a callback. Or sometimes it used to be, we had instances where patients say maybe they're, and this is not always the case, but things happen when you're so busy. We went through COVID when we were not really seeing a lot of patients, and then we went boom to in person, and there was just such an onslaught of a lot of information and just getting everybody in a good flow. So that really helped. That really helped, and significantly statistically, actually, after we extrapolated the data and collected, realized like, hey, from a 50 to 60% difference when that sort of steps were implemented. And it educated patients, hey, if you don't hear back from us, you can send a message. Hey, if you don't hear back from us, give us a call. So that it made patients more of an active participator in their health, which then improved the overall quality of interaction and just relationship with patients in the program.
So a very practical way that you can do a quality improvement type project in the office setting, right?
Yeah.
So something that our practicing physicians, you see inefficiencies all the time beside the EMR, but just in the way that we practice, sometimes the antiquated ways, there's newer and better ways to do things. And so what a great way to do it. Can you just talk real quick about the PDSA cycle and what that looks like in general?
Yeah, so PDSA as in plan, do, study, act, right? So you plan on something, you realize, hey, something's not quite right. You do something about it. You either collect the information, you review it, you study, hence an analysis and things like that, and act. So you implement it. Something simple in the office could be, especially, for example, screening modules. Hey, can all our patients 45, now that the indications have changed from 50 to 45, have they all been screened? Can we go through our EMR system? And this is also, to be honest, also a flexibility of what your EMR can provide. Some patient, we have transitioned for a long time from paper charts in our clinic to more of this older EMR system, but there might be just not the ability to get the latest spanking new EMR to kind of do all of this. So you got to work with what you have. Right? We're not asking you to create new formulations for yourself, but that was the idea. You identify, hey, we're not hearing back from patient A. I haven't seen them in the past 2 years because of COVID. I wonder what's going on. Oh, now they're 45. They don't have 5 more years to get screened for colonoscopy. Maybe there's a way that we can, kind of sort through our numbers and say, hey, do we have those quality metrics in place? So, yeah.
Dr. Bettini, are you in private practice? I'm sure that these little small incremental research projects, these quality improvement projects are really applicable. And then also for faculty as well. It's one way faculty can be involved.
Well, that's what I was going to say. This is a perfect opportunity for faculty who are in private practice or even in teaching centers to be more involved in how their practice is running and to have residents be doing research in their own office and improve the efficiency, I think would have them very interested in doing this. So yeah, this is a great way to get faculty involved in different projects and in even the research projects, which is part of the ACGMA requirements too, is that faculty be involved. So it's a very simple and easy way for them to do this. So I think it's a great program for something like that. You're right.
Other ways that faculty can be involved, clinical, people are teachers. A lot of physicians are teachers, and how else can they maybe be involved in research?
Well, they can actually be the faculty mentor for a specific research project, and they can also provide their own direct research if they're interested in doing things and have the residents assist them, whether it's a clinical or even to the point of, like I said, with a institutional review board type human research project. So there's a lot of opportunities for them to get involved in something like this. But I think starting out with quality improvement type things would be very enticing for a lot of practicing physicians who also teach.
Excellent. Dr. Duffy, you also had done some not bench chemistry and not necessarily quality improvement projects, but an education component to research. What was your education?
So one of the quality improvement projects that, you can also do is to look at within yourself as a resident for, those who are going to be going into residency or in residency right now. You can look at what ways you can improve your residency program just the way that you would improve your office practice or your clinical site. Chose to look at our didactic time that we have dedicated to education apart from our normal clinical responsibilities. And, there was something that I identified that we were really missing a good, strong way to workshop procedures and get people the procedural skills necessary to be able to take those skills then into clinic and be more facile with office-based procedures. So actually I put together a small curriculum, in the context of family medicine of some of the more common office-based procedures that I could find ways to effectively and, inexpensively practice the core skills of some of the basic procedures that you might do in an office: a shave and a punch biopsy, a laceration repair, cryosurgery if you're, freezing, warts off of people or moles or things like that. And finding a way to bring that for us so that we can have more facility with it. Then we can empower ourselves to bring that back out to our clinical practice and improve, the way that we practice and the impact that we have on our patients on a daily basis.
Great. We're near the end of the time of our opportunity here to talk about research. And I did want to just make sure that I highlighted. So the Pennsylvania Osteopathic Medical Association has a foundation that is affiliated with the association. But the foundation's goal is to really promote osteopathic principles for the osteopathic community and the greater public community as well. Really bringing that whole person perspective and supporting projects and research in that regard. In this last year, the POMA Foundation has sponsored 2 rounds per year of research and community-based projects funding for it. So there's 2 grant cycles per year. In the latter part of the year, we had a large grant opportunity, really focusing on different community-based projects that impact the larger community in Pennsylvania. And then this spring, we're finishing up our smaller grant. We call them Bright Idea Grant, that basically are to help support some smaller projects, these quality improvement type projects and some research type projects as well. So there is opportunity to take a look at that on the POMA website, which is POMA.org. And you can look up information about the foundation and the different kinds of projects that they will support. The other thing Dr. Rattini had mentioned about opportunities, not just in doing these quality projects and poster presentations and whatnot, but also participating on professional committees. Now, a lot of hospitals and health systems will have opportunity for residents to sit in on their different committees, but there's certainly more residents than there are committees and opportunities there. So one thing that the Pennsylvania Osteopathic Medical Association has done is on every one of our committees, we have allowed students and residents, not only do you network with fellow physicians who will soon one day be your colleagues, but you're also learning some of the management of professional associations and making an impact on healthcare. So some opportunities just through the Pennsylvania Osteopathic Medical Association. We'll just do some final thoughts here. There's a lot of opportunity. We are physicians and we're lifelong learners. And I would encourage that when you have opportunity opportunity to jump in on these kind of projects, or if you have a need, that there's options out there. Dr. Rattini, anything you want to add in summary?
I was just going to say that, this can be fun. It can be stimulating. This isn't a chore or a burden. It can be, in addition to being very educational, it can be very enlightening. And having a faculty and resident interactions like this is fantastic. And more people should be embracing this.
Excellent. Dr. D'Souza.
Yes. So one thing I would encourage from a point of residence is that your patients sometimes end up being your teachers. So you might come across new patients or just patients that you've seen for a long time talk about newer drugs that are on the market, something that you probably haven't heard as a resident or even in medical school because, a lot of things are changing. One of the helpful websites that I found was clinicaltrials.gov that allows you to actually go directly to the source of this particular trial or any new medication that they've come up because they have to register with this website. And this allows you to get at least an unbiased view of what the research was about so that you can appropriately talk to your patients about these new medications. It probably even helps you connect with certain specialists that are using these newer drugs or agents or newer indications. And that way you have communication with your peers and form a network of people so that you're not just by yourself. And I think when you go into practice, that can sometimes feel like it because you're not in a physical building program with other residents who are in the same boat swimming in the same direction. So be open to, research looking in different forms and have fun. Yeah.
Dr. Duffy, last comments.
Last words. I would say just to keep in mind that this is another way to help your patients. We're not just doing research for the sake of doing research. We're not just sitting on committees to sit on committees. We're doing this because this is another facet of the way that we can help the practice of medicine help others. And that's really the name of the game at the end of the day.
Excellent. Well, doctors, thank you all so very much for conversing about research, something that we all enjoy and things that we've really found helpful. And Dr. Duffy, like you had said, this is really about our patients and about how we're improving healthcare and the practice of medicine. So thank you, each of you, for your time today. And if you're watching this and you have any feedback or episode ideas, you can always email POMA, that's POMA at POMA.org. And be sure to subscribe to the POMA Does podcast series for your favorite podcast platform or POMA's YouTube channel where you can watch these and other educational podcasts as well. Thank you all so very much. We'll see you next time.
Thank you, guys.
Thank you.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube, or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.